We are back here on Carolina Women with our friend, Cathy Ulmer from Ulmer's Pharmacy.
Across the bridge.
Across the bridge, exactly.
Oh, man.
It's fun. We were talking a little bit before we started about the discussion today, and I was sharing with you that I had one of my clients who had been to 3 or 4 doctors after having a lot of different symptoms.
Right.
And some of them were emotional symptoms too, because he was frustrated because he still felt lousy after going to a bunch of different docs. But I said, have you been to your pharmacist? Because that's what you tell us to do.
Yes, yes.
And not ironically, interestingly enough, he spent about 45 minutes with his pharmacist. Thank you.
Yes.
The pharmacist feels better.
Yeah.
So talk to us a little bit about that.
Well, that's one of those continuity of care that we're always concerned about. With going to multiple pharmacies, because of course you're trying to look for the right price,
right.
And also going to multiple doctors. So kind of like I was saying, I had a customer who was seeing a cardiologist and a primary care, and they both were prescribing blood pressure medications. Well, they didn't get communicated between the 2 doctors, or the patient didn't find it, was forgot to put it down, or wherever the communication broke through. So when I sat down with her, we called a cardiologist, stopped one of her blood pressure medications, and just maximized it for adding another
Was
medication.
it the interaction, or were they getting too much?
It's just, it wasn't even about too much. It was just, well, it would have been about too much, because the cardiologist didn't know she was taking this other blood pressure medication.
That's almost scary. That could be dangerous.
But I think,
he's thinking she's controlled on her, what he's given her, when she's not. And then again, it could cause interactions, duplications.
Are you surprised by how many people don't know what medicines they're taking? Because I ask in my practice, what medications are you taking?
Yeah.
And they may say, I'm taking something for blood pressure, I'm taking something for this, but rarely do they know the name. Even more rarely do they know the dose.
Or what the medication may be for.
Correct.
Yes, that's a huge thing. So I'm usually talking to patients about this is my water pill, this is my pressure pill, this is, instead just kind of at least knowing kind of the gist of how to say the name and what it's for. So what I do for a lot of patients is every year I print out a list of their medications, a wallet size.
Oh, cool.
So they can have it in there, and then we kind of write down what each medication's for. So every time you go to the ER, they're like, what medications do you take? Well, I don't know.
It's really important
call
to
my
know.
pharmacies, or all that kind of stuff. So having a list of that, and knowing what they're for and why you're taking them, and again, really important, and I can't
emphasize
this enough, is when to take those medications.
I was going to say, I bet
together?
there's instructions on, or taking it with food,
There is,
maybe, spreading
and
that
some
out.
of them only say, take every day.
Okay.
Well, there's 24 hours in the day.
Got it.
Should I take them all together? Some acid reflux medications should be taken 30 minutes before your biggest meal of the day, not just randomly, or it's not going to work as well.
Let me ask you a question. I thought you were going to ask this because it was really interesting. Do you recommend people read the side effects and all the paperwork that comes with medicine?
Oh my gosh, the side effects on the commercials,
Well,
those are scary.
And I ask you that because oftentimes the folks that have the medicine, like this one guy, he knew more about the side effects than he did about what he was taking the medicine for.
I caveat that as, yes, you should read all about the medication you're taking. However, it is going to be overwhelming.
Okay.
So I usually say the best thing to do is kind of read over it, and then, ask your pharmacist or your doctor just to say, what's most common, what should I really look for? Because
what
it can
might affect one person may not affect another, so there's no reason to let
we have to, legally put all these adverse effects, but it doesn't say, well, 90% have this, 10% have this, so there's main things that we look at when we look at the clinical data to say, these are the main things you should look at.
Okay.
However, if you see this, stop taking the medication. Or, these are just mild, or, every single drug has GI side effects. I mean,
is that
it's
true?
going to be listed on the side effects.
Oh, got it.
Because somebody could have a stomach ache from taking any medications. So there's some things that are always listed, and so there's main things that we as pharmacists look for, but knowing what's there and not thinking that that's going to happen, because it can cause that I start taking this and immediately I started having headaches. Well,
exactly. Oh, I have dry mouth.
I read all these things, but I have all these side effects. Well, let's analyze it.
Right.
Let's talk about how we can decide whether the drug's causing that.
Right, because
side
people are
effect or
quick to
not.
blame it on the medicine,
They
but they
are.
might not have had a glass
Yeah.
of water that day.
Or they just don't want,
No,
or
that's
they just don't
true.
want to take the medication. They're just
Right.
like, well, I'm not going to take it because look at all
Boom.
these side effects. And you're like, well,
Right.
yes, but
Do the benefits outweigh the risks?
yeah, the benefit versus the risk is huge.
Oh,
Yeah.
it makes so much sense. I tell you, every time you come, I learn something. It's really
know.
wonderful.
Yeah.
I appreciate you coming. Stay with us. There's more to come here on Carolina Women.